Well, hello and welcome. And today we are looking at another very important issue, health. What else is more important than health? Well, with the spate of accidents coming, it's now bringing into question our emergency services in Ghana. Response times for ambulance, the infamous Kintampo accident, and after that there's been a spate of really horrific accidents across the nation. So the question comes again, the ambulance services. But my question is, indeed, do we care, you and I as a people? Now I say this because, God bless his soul, when President Mills passed, and the issue was how was he transported to the hospital, it was never clarified. But then Professor Badu Akosa came up and said, listen, these ambulances that are crisscrossing our roads, beeping all the time, has any of us checked if they can support life in case of an emergency? You know what? All the serial callers rang into radio station and rain abused on him. I was shocked. Because indeed, if you look at Professor's stature, he's got doctor friends and could probably call and get help. So it's you and I who would need these ambulance services. So if he raises the question about the standard of ambulances, one would wonder, why would this deserve an insult? But it did. You take my instance. I was trying to find out where my MP was. Guess where she is? She's in America to give birth. Oh yes, she's in America to give birth in obviously a very superior health care that will be delivered. When she comes, guess what? You and I will queue up again and give her our mandate that, you know what? Carry on being an MP. So my question is, do we care? Lastly, now one district, I'm going to save the name, when the DC assumed power within his district, the first thing he did was kick the ambulance crew out, because ambulance crews indeed don't have permanent offices across the country. He kicked them out because, you know why? It is the MPP time that this ambulance station was set up. So again, I'm asking, do we care? Or are we just going to make hoo-ha when incidents like this happen and then we forget it? We have more luxury cars than we have ambulances. Should that be the case? Well, we're going to have a discussion, and I hope you join too to find out if indeed we care. And if we do, are we showing it? My name is Anan Sakwa, and this is PM Express. When I come back, I'm talking to a man who knows how the ambulance services work. Well, we are looking at the state of Ghana's emergency services, the ambulance service, and indeed, after the ambulance has picked you up and taken you to the emergency center, what services do you get there? And how many of us have been kicking up and down? Have we been frustrated enough to find out who provides that service, and indeed if they are providing this? With me in the studio today is Professor Ahmed N. Zakaria, who is obviously in charge of Ghana's ambulance services. Prof, you're welcome.
Thank you, Sanana.
Prof, let's start with the history of Ghana's ambulance. I mean, where did it come from, and when did we start?
Yes, Nana. You realize that before the stadium disaster in 2001, we didn't have any organized nationwide pre-hospital care system or otherwise ambulance system. So the disaster of the stadium was a wake-up call. And that was when a committee was set up to really investigate and look into the causes of the high mortalities that we really registered. And eventually the findings came out that the absence of an organized EMS or emergency medical service system really played a key. And therefore the Ministry of Health was tasked together with the Ministry of Interior to look up at setting an EMS or an ambulance system. So it was not until 2004 the first pilot program was started. And when
so before that, we didn't actually have a national?
We didn't have a nationwide organized EMS. We just have isolated ambulances scattered in various hospitals.
Okay.
But a nationwide EMS system did not exist.
Wow.
This, exactly.
2004?
2004 was when the first pilot program started. And it started with 3 stations in Ashanti, 3 stations in Greater Accra region, and 1 station in Eastern region. The Eastern region one was in Nkoko. And at the time, the criteria for setting up the ambulance stations was accident-prone areas. So following the success story of the pilot program, there was a need to scale up. So the system was scaled up, and then we increased the number from 7 to 24 stations, covering various locations. So at the end of 2008, the 24 stations were still operational. Then the NDC government took over, and the first batch of the 161 ambulances were bought in 2010. And that was what increased the fleet, and therefore the number of stations increased from 24 to 130. So we started with that kind of operational system up till now. And personnel-wise, we just started with only 57 staff, and currently we have 1,700. In terms of other...
That's nationwide.
Nationwide, absolutely. In terms of other areas, you realize that the service started as a unit under a directorate in the Ministry of Health. And so it just started as a small unit with 1 office under the directorate of PPME, the Policy Planning, Monitoring, Evaluation Unit. We were able to work and then expand the service. And from a unit, we migrated into the status of a directorate. And then we got 3 offices more at the Ministry of Health premises, still operating from there and supervising the activities of the service across the country. At the time, our training was done at the Fire Academy and training school around Jamestown, opposite the abattoir there. Okay. So basically, we didn't have our own training center. So we used to parasite with the Fire Academy and training school. And so that was also creating difficulties for us, because then it means that each time the fire service was doing training, it means the ambulance service had to suspend its training. Fortunately also, we were able, with the support of the government, to acquire our own training center in Nkinkanso, what is known as the Paramedic and Emergency Care Training School in Nkinkanso in Ashanti region. So basically, if you look at it from that perspective, there has also been some improvement. In terms of office space, from the 3 just small offices we had at the ministry, the government has been able to help us acquire a whole building, now serving as the headquarters for the National Ambulance Service. So if you look at it from the perspective of growth, it means that it is growing in the right direction. Now, the reason people tend to despair a bit is when you immediately compare what pertains in Ghana and juxtapose it with what pertains in the developed world. And that is where I want, with your permission, to really explain the whole concept of the EMS. And then when we understand the 2 systems that operate internationally, emergency medical service. You know, I'll use them interchangeably. The emergency medical service is the same as the ambulance service.
Okay.
But the reason many countries, and especially the developed countries, prefer the EMS or the emergency medical service as against the ambulance service is that the concept of EMS has evolved from, and it has changed from just an ordinary system of transport to providing preliminary care in the pre-hospital setting. And so basically, if you talk about EMS, it means that you're talking about a system that provides both care at the scene of an accident and at the same time provide care whilst you are transporting the patient. So that system definitely encompasses what we call the EMS or emergency medical service system. The whole concept about EMS simply means that it's the synonym of paramedic service or ambulance service. It's a kind of emergency service that is dedicated to providing out-of-hospital acute medical care, transport to definitive care, or any form of transport to patients who may be suffering from illnesses or injuries that may prevent them from transporting themselves. So looking at that concept, internationally we have 2 systems, what we call the Franco-German system and what also is known as the Anglo-American system. The Franco-German system is what pertains in Europe, where the pre-hospital care is provided by doctors, nurses.
So there's a doctor in the ambulance?
Absolutely. So they take the emergency care department into the field. So in other words, we are transporting the emergency system to the patient. As against the Anglo-American system, where they will now rather prefer to scoop the patient and run to the hospital. So these are the two systems that operate internationally. The Franco-German system means that you stay and play. It means that you have all the time to provide the care and then transport the patient to the hospital. Whereas the Anglo-American system, which is the scoop and run, is based on what is known as the golden hour rule, where it is conceptualized that within an hour of an accident, you should be able to get a patient to the hospital because that's where the patient can get best care. Because depending on the degree of injury or mechanism of injury, some of the care cannot be provided in the pre-hospital setting. So that's what the Americans and the British operate. And their system is normally provided by pre-hospital care specialists, like the paramedics or emergency medical technicians. So we in Ghana have emulated the Anglo-American system, and there are obvious reasons for that. Research has shown that none of the systems is more superior than the other. You can choose either depending on convenience or availability of resources. So basically, taking that system, this is how the system works. First of all, it has various components. Component number one is that you should define an emergency-free number. Other people use 911, others use 112, depending on the country. But Ghana, we chose 193. So once that emergency system exists, the next thing you need to choose is the dispatch system, dispatch center.
So 193 is for ambulance or for emergency?
Ambulance now.
Ambulance, okay.
Yes, because we used to have a global number 999, but it was having challenges. So every emergency service in the country now has chosen its own. Police is 191, fire department is 192, and we are 193. So once you have that, you have identified the emergency number. The next thing is the dispatch center, where you have trained paramedics. They go through what we call EMD, emergency medical dispatch, and they base their operations on what we call the advanced priority medical dispatch system. What it means is that they categorize the calls, Nana. And so when a caller calls into the department, they will have to take the person through a systematized system of interrogation. And they are able to categorize the emergency as category A, which is life-threatening, category B, which is urgent, but not life-threatening, and category C, which is routine. So the category A's are the ones that we call siren emergencies.
Doc, hold on for me 1 second. Now it's 0560 800 000. I haven't called the ambulance before, so I can attest or I can verify that if you go through all this. So 0560 800 000. Send your messages in. You may have had challenges, or you may have said, look, I rang and that's exactly the service I got. Then, we share it with the audience. So sorry to interrupt.
So basically, Nana, just explain how the system works. So definitely you call the 193. So barring any technical hitches, you're supposed to get them through either a landline or a mobile phone. And so that is how, when it gets to them, they will now take you through questioning where your location is, what is the emergency, they will take your number, and then they will now dispatch the ambulance to you. So basically, that is the kind of system we operate.
Before you continue, with regards to location, I mean, how are you finding people? I mean, with that location, has it been a challenge?
When a crew is posted to a particular location, they spend a month doing what we call familiarization tour of the area. So they are able to identify, before the renaming of the streets, they are able to identify landmarks that are easy to locate. And so the way they operate is that if you call them, for example, and you are around this area, at least once you are popular, they may use you as the landmark direction.
Near Joy FM.
Absolutely.
Near
So
JT.
that's the kind of system they operate. Sometimes it's very easy, especially if the landmark is very easy to locate. Other times too, they are a bit of a challenge. What we don't encourage is the one they use the sellers. Because if you use a seller of wachi or a seller of something within the locality, and it rains that day and the person is not there, that becomes a problem. So most of the time, apart from the street names, the other thing they may use will just definitely be landmarks like churches, mosques, or schools, etc. So basically, that is how the system works.
Okay.
So looking at it from the perspective of a country, a developing country for that matter, if you look at where we are, without blowing our own horns, in this whole sub-region, apart from South Africa, Ghana is the next country that has an organized EMS. Not even Nigeria, that is bigger than us. They have just private scattered EMS. So in
Egypt?
Egypt, yeah, Egypt also has, yeah. Egypt, South Africa, and Ghana. Good. So basically, if you look at the system, from the perspective of a cup half empty, you may want to say, oh, there is nothing. But from a perspective of a cup half full, you realize that looking at where we started, from 0 to 7 to 24 to 130, definitely is an improvement. And in terms of staff, from 57 to, let's say, 200 to now 1,700, there's also improvement. Without the systems, definitely we have a challenge. But once we are building the systems, all we need now is just to resource the systems, and we'll definitely be meeting international standards. What I always want us to accept is that if you visit any AMS anywhere in the world, they will tell you that even the speed at which we have grown is faster than what the UK and even the US have taken to. We are having partnership with North Dakota, a state in the US, and definitely they share their experience with us. And obviously, without any exaggeration, our EMS system is in the right direction. All we need now is to accept the fact that there are still challenges, and we need to really improve it. The reason I'm happy about this kind of discussion is that as a country, once we are developing, we need to move our EMS system along. Because research has shown that when you have an effective pre-hospital emergency care system, obviously it improves outcome in your health delivery system. Because without an effective EMS system, it means that cases that will be getting into your hospitals will go in moribund states, and that even will affect outcome. So currently, as we speak now, we have some ambulances in the country. Some districts have the benefit of the service. We are now expanding to cover virtually all district capitals. Initially, we started with the criteria of just accident proneness. But if you continue with that, it means that you'll be depriving areas with high maternal and child mortality rates of such services. And equally, you realize that every district capital definitely deserves an ambulance station. So currently, we have the 3 criteria we've combined to expand the service, both accident proneness, the high rates of high maternal mortality, and also the fact that every district capital deserves the service. Establishing an EMS generally is capital intensive because first of all, you need to procure the vehicles. Secondly, you need to train the paramedics or emergency medical technicians. Thirdly, you need to expand the service in the various district capitals. And on top of all this, you would definitely need to have enough resources to provide both fuel and maintenance. And especially when the cost of fuel is going up, the price of fuel is going up, and then you have also maintenance, spare parts going up, the cost going up. Definitely it affects the service. One peculiar challenge we have in Ghana operating our EMS is the fact that many patients are not insured. And the second reality is that at the time the law of the health insurance law was being promulgated, the EMS did not exist, or the ambulance service did not exist, so it was not captured. So currently, we are not part of the beneficiary packages of the health insurance. So then that brings us a lot of burden, that the only resources you receive is what you receive through your budget allocation, which most invariably sometimes is inadequate. And once you expand that, it means that you have some challenges recouping immediately because you don't have the reimbursement system. And so we definitely have to assess some dedicated source of funding, which definitely would take care of this service, because as emergency services, you definitely don't have the luxury of charging patients. When we also want to look at the other issues that may serve as a challenge to our emergency medical service system, we also want to really look at the first responder system. Because if you go to many developed countries, the reason why their response time is shorter than what everybody will expect is this. Their first responders are provided by certain institutions. like the fire department, the police department, volunteer organizations. So what they do is that...
They have biker ambulance?
Absolutely. They are trained in basic first aid. Those agencies have a wing that provide the first responder system. So when there is an emergency, they are the first to arrive. They start stabilizing the patient or providing basic first aid, whereas they inform the EMS or the ambulance service to go. So by the time you arrive, at least some response has been provided. You just take over and provide the care, and then you transport the patient to the hospital. Because Ghana, we don't have that system, it means that it's the EMS, the ambulance service, that provides both the first responder system and the EMS system. And because we are not everywhere...
So when the UK is saying that on critical cases, the ambulance should be there in 8 minutes, what they mean is the
Yeah, absolutely. Because the first responder system, that's what they mean. So because they all form part of the EMS system.
Okay.
So when the UK, they are talking of the response time, it's not necessarily the ambulance arriving there. There's always a first responder. And the first responder will always, his attention or his services are counted as part of the emergency response, as the response time. Now, so basically, they will have the improvement. And you know, around everywhere in the town of any of the cities, you realize that the first responders are there, sometimes at the corner. So their first response time is very short. Our case, our response time delays because depending on where the ambulance is supposed to come from, if it's within your locality, it means that the response time will be short. But if at the time the ambulance within your locality is on errands, it means that you have to dispatch one from a different distance, and sometimes that delays. So basically, if we look at it, that is exactly the reason our response time may delay. So basically, looking at how the system is structured, you look at it that there's a need for first responder, and that will have also...
Can we add the bikes to your fleet? I mean, I don't think they cost... They'll be that expensive to run.
Absolutely. It's because you will need, all can form part of... So the bike system will be your first responder system. So they will normally go and then start with your pre-hospital assessment, providing the basic first aid. And then the EMS is normally called to come and take over. So basically, that is how the system operates. The other thing maybe I may want to explain is the level of care that is provided by the pre-hospital setting. You know, we have two categories of ambulances, what we call the basic life support ambulance, and then we have with the advanced life support.
Doc, let me interject. I mean, are these things you are talking, things on paper or things that happen out there? Because the perception of the ambulance out there is not as sweet as you're saying it
It's
here.
because of the way the discussions normally go. Because most of the time, when these discussions are being held, we tend to rather project the discussion from the perspective of a cup half empty. And that's when you have a lot of callers calling to rather vent their frustrations. If for once we decide to look at the cup half full and you invite people to share their experience, obviously you have people who will definitely testify to the usage of the service.
And that's what I'm calling for. So 0560 800 000, 0560 800 000. Send your messages in and share your experiences.
Because if we decide to look at it from that perspective, first of all, it will motivate the young men who are out there providing the service and risking their lives. But if we most of the time look at it as if there is virtually nothing or nothing is being done, it's very easy to get people who will definitely vent their frustration. But the reason I always want us to be very objective about this is that this is a system that is growing. And at no point have we deluded ourselves that we are perfect. And we've also always admitted that there are challenges. And even in our own homes, we do have challenges. The only thing is that how do you really address the challenges? And once you are building the systems, that is good news enough. And so all we need to do now with your help and support to really advocate for more resources. The other reality is that even in the most advanced countries, the public sector alone is not able to provide enough to cover the needs, the pre-hospital needs of the people. So there's the need for public-private participation. And that's when you have even what we call private EMS. And so once we are developing and people see the need to even develop private EMS to complement what the public sector has, definitely is going to help us. So I will really still emphasize the fact that 193 exists, and if you dial, for example, 193 and you don't get, you can help us call maybe the mobile network companies to order, because if people are patronizing your service, when they need the service most is for emergencies. So you should be able, as part of your corporate social responsibility, assist them to ensure that at least the 193 is very active on your service. So in that regard, the media really has a role to play to help us. Because, for example, whilst we're talking now, if you try MTN 193, you're able to get access to the emergency dispatch center. It means that MTN is operational with that number. If you dial Vodafone, the same. So these kind of checks, on and off checks, can really help us maybe put them on their feet so that they can help the system to work. It's very important. Once we are able to improve our emergency medical dispatch system, the next level now is to improve the fleet. How do we do that? We all know that the lifespan of every emergency vehicle is normally 5 years because of the nature of the operations. So it means that we should, as part of our planning process, ensure that in every 5 years, there's the plan to get new fleet. Even if not to entirely replace the old ones, but at least to augment the fleet. The other reality is that we should be able to get to a point where every ambulance station has a backup in terms of a standby ambulance, so that if the one that is operational is out of commission for obvious reasons, there's a second one in replacement. Once we all start looking at how the EMS system operates, and the fact that we should aspire to a point where we'll eliminate the taxi ambulances or commercial vehicle ambulances, we will have been moving in the right direction. The reason we try to make this emphasis is this. If you have a certain condition that is an emergency, it means you need some care. At that time, the taxi cannot provide you with the oxygen you may need. It may not even provide you with the care that you may need. And that even brings an interesting component. If you are very observant, you realize that for all the emergency vehicles, you see the star of life. If you compare it to the hearse, you see that the hearse is just a cross. There's a reason for that. The reason is that for every ambulance to be called an ambulance or emergency vehicle, the star has 6 components. Each of the arm means something, and that's why you have the 6 star. First star means that there's early detection. It means that in your society, somebody should be able to detect that there is a problem. Like, whilst we are here, there should be a mechanism to detect a problem early. There should be early reporting, which is the second arm. It means that your ambulance service should be such that when there is a problem, somebody can report. Now, when they have reported, and the reporting is through this emergency line I'm talking about, then there's early response. It means that your dispatch center should be able to send people early. Then there's a fourth component of the arm, which is good on-scene care. It means that your system should be built in such a way that when they arrive, they are able to provide good on-scene care. Then there is a fifth component, which is care in transit. It means that as you transport the patient to the hospital, you should have the capability to continuously provide the care. And then the last arm is transport to definitive care. So you realize that because this is based on the principles of basic first aid, which is to prevent injury, promote recovery, it means that we should always, at every point in time, have this in consideration.
Let me take a break here and then we come back and continue, because that is what brings me to my initial question, is that as a people, indeed, do we care enough about our health? If you look at how cars are hurtling down the road with passengers in it, and they say because of our upbringing, we keep quiet. You look at the hazards that we live about all the time, and indeed the spate of accidents that are going on. How does this limited service cope? We're coming back. Well, thank you very much for staying. The state of Ghana's emergency services. And with me in the studio is Professor Ahmed Zakaria, who's in charge of the ambulance services in the country. And he's saying the cup is half full. It is not half empty. Indeed, we're doing better. But some of the messages are coming in, so let me catch up. This is a kindly ask, Prof, whether the recent supposed ambulances are fully furnished, and if he was contacted before this recent ambulances were purchased. Those ambulances cannot be called ambulances simply because there are not a single monitoring machine inside. This is Nana Kwame. Let me go to a next one. Nana is your guest talking about over 100 stations or 100 ambulances. This is Awo in Aflao. This one is from Opening Ejekum in Kumasi. Please, what are you doing about those commercial drivers who intentionally ignore the ambulances when on their businesses? Well, everybody is using the siren now. You can't even tell when it's an emergency. But we get Doc together. Good evening. Please ask Prof about the Ambulance Act that is pending in Parliament. This is from Della. Let me take one that's just come in. Hold on. Get this one here. I work in the mineral and mining industry, and we have a specialized department, and our motto is safety is our first value, and nothing is more important than a human being. And even if we are called to specialized operation, such as chemical spillage at different locations from the mine, we have to be ready in 10 minutes. That moment the notification comes. And this is Prince in the Obuasi mines, and it's 0560 800 000. I just want to find out, have you ever called an ambulance service, and what service did you give? So send me a message now if you've ever called an ambulance service, and what was the response? Were they courteous? Did they take time, calm you down, get your location, get there? What was the response? Just let us know. So indeed, these are some of the questions that...
Yeah. So basically, Nana, I like those questions because it's just trying to get more information. And the reason I want us to have this discussion from this perspective is that it means that we are all contributing to improving the system. Then it means that in our own small way, even from our homes, we are able to send ideas that will affect the system. So in terms of what the issues have been, normally the procurement process goes through various stages. And so, first of all, there will be the request, it goes to cabinet, it goes to parliament, and afterwards, then there's tender, and then they get a supplier for it. In terms of the supplies, it means that you have to carry what we call pre-delivery inspection before the ambulances even arrive in the country.
Let me just give you this one. This is Mashoud from Tamale. Ambulance services in Tamale is effective. I witnessed a situation in Kalamponi in Tamale where they responded fast and saved life. They are doing well. When I called them, they were good. So that's one from Mashoud.
Yeah. So you know, with Mashoud message, that's the kind of issue I want us to look at and see that what are the challenges that the current system is providing? How do we improve them? Because every region, we have what we call the regional office, which is normally manned by the regional medical director or the regional coordinator. So he is in charge of the region, and he organizes the service in the region. And if they have challenges, then they contact us. Tamale is very efficient because they have a very efficient regional coordinator. He liaises with the officers in charge at the various ambulance stations across, and they're in constant interaction. And so when there are challenges, they are able to address it. What we do with our service is that when you call the emergency line, and then you provide your information, and they dispatch the ambulance, we have what we call offline medical direction. So it means that when the crew arrives, and they are providing the care, and they run into any difficulties, then they will contact their regional medical director or regional coordinator for solution. So every region that you have a very proactive, dedicated and committed regional coordinator, you will have the system very efficient. So generally across the country, we have regional coordinators for every region. And so, yeah, sorry, Nana.
This one says, good evening, Nana. I have met Doc and I have a lot of respect for him and what he does. People are still being asked to pay for ambulance service in Ghana. Is it a paid service? He's asking. Doc has told me personally that that isn't a paid service, but the drivers collect money for fuel. Which is it? A paid service or a service free for all Ghanaians? This is from Cyril. He comes in again and said they demand money before they pick up the emergency. I have reported it once. Dr. Zakaria personally took the report, handed me over to the Ministry of Health Logistics Department, and that was it. Nothing came of it again. They are still asking for money from families of patients.
Yeah. So that is another challenge we are having. Normally, the paramedics are not supposed to charge for emergencies that they attend to, because we do explain that if there is an emergency, you have no right to ask for payment. Mm-hmm. Where there is a challenge is the inter-facility transfers. Normally, they are normally provided fuel for emergencies. Mm-hmm. So if you are supposed to use the allocation for emergencies to transport a patient to a long distance, it means that you consume what you are supposed to use to run emergencies. So sometimes there is an arrangement for the hospital to pay for the fuel to do the inter-facility transfer. Mm-hmm. In the event where the hospital is not in a position and the patient is prepared because they will have had to look for their own means, then it means that they make the arrangement and they pay. But for all emergencies, the answer is categoric no.
So they can't come to an accident site and say,
not
well,
at all, not at all.
If you don't give me money,
not at all, not at all. Because for emergencies, the government provides cover for that. So basically, if you look at it, because it's a human...
But you see, there have been times where ambulances have said, look, we haven't got fuel. We've run out of fuel.
That is the
issue. So if there's an emergency and it's your emergency and you can fuel it...
Exactly. So that's where the hitch is, because truly, with all intents and purposes, there is an emergency. Maybe they have not yet received their fuel allocation. Mm-hmm. And so rather than using my money to go and take a vehicle, I would rather prefer to use that money to fuel the ambulance. So I really, at this point, want to appeal to the public that we are partners in development, and they should look at it as the fact that we are helping each other. Because if we want to really cast the whole thing in stone, we're rather going to disadvantage our people. We will wish that we had all the resources to provide the free care, which is the norm. But in the event where there are challenges, which we must admit, because sometimes there is a delay in the paramedics receiving their fuel allocation. Because the way the fuel is distributed, as part of internal control, they will allocate your fuel to you. You use it to run emergencies, and then you will send your returns, and then you get new allocation. So sometimes there is a delay, or sometimes you may have used more than you will anticipate. Because if you are supposed to use it for 1 month, and because during that month you've spent so much because of many emergencies, it means that your returns will have to go earlier than anticipated. So if at that time you've exhausted what you have, and you are waiting for new allocation, and there is an emergency, and the person is prepared to pay, then that one is optional. But the reason I would say we should not really cast the whole decision in stone is that rather than keep to your money and risk losing your relation, if you can help them, that is eventually okay.
I think the frustration of people is that, you see, they don't see prudence from the top. Mm-hmm. So if you tell the people at the bottom that, oh, times are hard, but they are looking at the life and it doesn't look like times are hard, that's when, even though what you're saying would then make sense if I looked at the top and I said, oh, even there at the top, they are squeezing. So I think that's the frustration of people. And this morning on the morning show, you know, I could tell everybody is venting because they thought, look, hold on, you know, the government is not showing prudence. I mean, I got a message here. It says, this is all the way from UK. While Ghana National Ambulance Service is in dire need of logistics in carrying out the operations nationwide, President Mahama had found it wise in using millions of taxpayers' money in branding buses with his pictures and projecting a tainted image, you know. So this is then what happens. Okay, obviously fine, maybe President Ahmadi personally, but that's how the average citizen will look at it. We have 4 million cities to brand the bus, and the ambulance is grounded. That's our frustration.
Yeah, Nana. Yeah, but you see, once again, those are issues that don't have any direct correlation as far as the emergency response is concerned.
Oh, it's state money. So if I've paid my taxes, I'd rather they fuel an ambulance than brand the bus because it's my tax money. And if you're going to tell me that, Nana, out of your tax money, I'd like to put my pictures on a bus, or I'll leave fuel in the ambulance just in case, you know, a relative of yours gets ill. If I did a poll, I would be surprised if there's one person in Ghana who would rather their tax money. So then we get frustrated.
I get you. But those frustrations should not really prevent us from contributing to our own health. Because, you know, if you insist that the ambulances are completely free, Nana, the logic is that in the absence of the ambulance, what is the alternative? The alternative is to use, let's say, a private vehicle. And if you look at the amount of money you may spend, even if you are asked to help pay for the fuel, it might still be more cost beneficial than using that on a taxi. And so I don't really want to dwell so much on people really paying. The answer is no. They are not supposed to pay for emergencies. If it is an inter-facility transfer, definitely they may want you to pay. And you know the reason is this, Nana. If, let's say, I'm in Bolga, and I'm the officer in charge of the ambulance station, and I'm provided fuel for a month to run emergencies internally, and I'm asked to take a case from Bolga to Accra, it means I may even end up spending all my fuel just on one single patient, whereas the local running of emergencies could have taken me a month to even save more lives.
Wouldn't you hand them over to, let's say, Kumasi for Kumasi to take it over, or you have to do the whole trip?
Because the truth of the matter, the way the emergency medical system runs is such that everybody is programmed. Because if, let's say...
You own your patient.
Yes, because you know that every region has its own internal arrangements to provide the pre-hospital care. And so, and there are regional coordinators who definitely have different schedules. The reason is that if you are doing a transfer from Bolga to Korle Bu, it means that they have already spoken to the doctors. And there is already a continuity of care. And so if you want to do that transfer, the problem is who is responsible for the patients, because then sometimes there's a disconnect. So it's safer to have that continuous care.
This is from Kwame, and it says, Nana, please read my message. So Kwame, I'm going to read your message. But you didn't tell me where you are sending the message from. The VA drivers don't know how to drive. Based on the explanation of your panelist, they leave their powerful headlights on throughout, even when you are coming. And he comes in again and says, Nana, a few here in Chito, in the Volta region are good. But last time I called them, they asked me to buy 1 gallon of petrol. Eventually, the woman delivered on the ground in the house. This is Kwame. It says, can I work for the service as part-time without pay? I am a teacher.
Oh yeah, we have room for volunteers. And I'll even take advantage with his request and encourage that. You know, one of the reasons many of these developed countries have advanced is because of the spirit of volunteerism. Because you realize that when you have the volunteers, you can even treat them as first responders. And so he's more than welcome, and I will encourage more people to really offer their services.
Let me take a quick break here, and come back and catch up with all the messages that are coming, which are very encouraging. 0560 800 000. Don't move, we're coming straight back. Thank you very much for staying. Let me catch up with your messages. If this one would open. The police service in Wa should be intensified. For human life is very important. The police should stop giving excuses like we don't have means, no fuel in the vehicle and the rest. I think you're talking about ambulance. I don't know whether we have ambulances in Wa, and if we do, is it meant to assist everyone or only the rich persons? 193, if you have a problem, give them a call. This is Dennis from Aflao. Good evening, Nana. EMS is the rural area, in the rural areas are not the very best as expected. In the Volta region, corpses are conveyed than the sick. There are many occasions where the EMS personnel complain of breakdown of vehicles and shortage of fuel. Then this is Dennis talking about some of the challenges of EMS. Let's go here. This one says, the fact of the matter is that there is emergency service in Ghana. Because of some of these ambulances, you have to provide money for fuel before you deliver the service. Didn't get it. This is TB Janga. Now there is no emergency service in Ghana because their service is paid for before they move. But Doc, quickly, I know you're here on the ambulance, but let's quickly, once you've taken the patient to the emergency, I mean, those who are critical, I mean, that too is that's a death row.
Yes. Nana, once we are finished with the pre-hospital care discussion, we now have to look at emergency care in our health facilities. You realize that when we are building the hospitals, we normally don't factor the emergency departments, especially in the past. But now the new buildings are really taking that into consideration. So you realize that all the old hospitals, they may just have a few number of beds for emergencies. And unfortunately in Ghana, the only time people go to hospital is when they have emergencies. And that's why our emergency departments are always choked. And so we'll need to really expand the emergency department. The other thing we need to do is bed management. Because you go to the hospital, sometimes on the wards you have empty beds, but the emergency departments are choked. And so if there was a system of bed management, it means that somebody should be there constantly making sure patients move to the wards and giving room to the beds. But you realize that a patient will be taken, they move to one health facility, they say there's no bed at the emergency department, and there are no attempts to get the bed for the patient in the hospital. Then they move to another hospital. And there have been instances where you have the ambulance roaming from hospital to hospital, and sometimes go through all our hospitals in Accra, and they cannot get a patient. So yes, there are challenges at the level 2. Then it means the only way out is 2. One is to ensure that there's proper management of our bed so that we can quickly move patients. Ideally, the emergency department is supposed to house people just for 24 hours, stabilize them, and move them to either theater or the ward, so that constantly the place is free. The second thing is that we also need to get trained personnel at the emergency departments, because most often than not, they just post people who have just completed general nursing to the emergency department, so they themselves might not be as experienced as people who have undergone some emergency care nursing training, or even some emergency...
On the subject of training, this is from Angel in Accra, and it says, Nana, please read my message. Hi, Prof. When will you recruit more personnel?
We'll recruit personnel this year, but we're still waiting for the financial clearance. We've not got that yet.
So how does Angel do? How does he...
We'll notify Angel when the time is due.
Angel, so keep your ears on the ground.
Absolutely.
So, before I interjected, you're talking about moving people in 24 hours.
So basically, one of the major challenges that our health institutions maybe have is the fact that our emergency departments are very small. Because until the recent expansion of the Rich Hospital, the number of beds they had at the emergency department were very few. And so most of the time they are full. Even Korle Bu, that is our premier hospital, you realize that the emergency department is always choked because all the emergencies are always going there. So we also have to respect the gatekeeper system, such that you don't always have to go to the hospital if the polyclinic can solve your problem. But most of the time, people bypass the polyclinic and they go straight to the hospital. So diseases and ailments that could have been handled at the polyclinics are now being handled in the hospital. So that also calls for improvement in the area. Another critical area is the area of critical care or intensive care. You realize that many of our hospitals don't even have intensive care departments. And so if you are critically ill, it goes beyond the emergency department. So the question is, how do you get the services of the intensive care department? And so we encourage all regional hospitals to have intensive care units so that once the patient is moving from the district hospital to the regional hospital, in the event where they need intensive care, then definitely the facility will be available. Then the third component that will also come and complete our emergency response system is the area of the air ambulance. Because as a country is developing, and you get to a point where you start operating a domestic airline, air ambulance is mandatory and is a necessity, no longer a luxury. And the reason they recommend that internationally is that, God forbid, if any of these aircrafts that does domestic flying develops some disaster far away from any nearby town, it means the only way you can evacuate the victims will be through the air ambulance. We normally tend to be complacent with the Air Force, but the Air Force is not an air ambulance. And so it's not designed for that. The air ambulance is specifically designed as an air ambulance. And so the facilities are completely different.
So you have your oxygen.
Absolutely. The stretcher is there. There is space for everything. Emergency care, everything is there. So I think as a country where and other justification for it more than ever is the fact that if you look at the oil exploration, our real health infrastructure is located or located very far from the area. And so if something should happen in the Western region, for example, Efia Nkwanta will not be enough to handle. So it means you have to evacuate to both Komfo-Anokye and Korle Bu. And you can only do that by air ambulance and not through land transportation.
Doc, quickly, there was an issue about ambulances not meeting specification. I mean, surely in 2016, if you're ordering people can even order rockets to go to heaven. So, no one can tell us that where there's complication about ordering an ambulance. It's a tried and tested case. Who did the mess up? I know you can't say try. who did that mess up?
The reality is that if you look at the whole procurement process, there is a stage where we are involved, but not through all the processes. Now, there were challenges, I think, at the point of the production. And I think what happened was the absence of the pre-delivery inspection. Because most of the time, Nana, when you are supposed to have 3 pre-delivery inspections, before they start production,
somebody goes to the factory?
You go, I'm just explaining. The technical team has an input to ensure that the specifications are met. In the middle of the production, there's also another visit to ensure that your specifications are being carried out. And at the final stages, there's a third pre-delivery inspection to ensure that before the thing is shipped, the vehicle is shipped, you are satisfied that that is what is coming into your country. Unfortunately, in this particular case, the pre-delivery inspection...
Did we want something which is not in this world?
But no.
It's be a hard monitor, oxygen mask, stretcher, a chair for the nurse to sit on.
These ones, they are there. You see, we did a post-delivery inspection and we discovered the anomalies.
So what is missing in this one?
What is missing in this particular one is that all the medical equipment are not there. And
I know. So what did you want that's not in there?
No. Any medical, because you needed the monitor which is not there. You
Heart
needed
monitor?
the AED, the automated external defibrillator.
That's what?
It's like the one that will shock the heart when there is a problem.
Okay.
Yes. So the truth of the matter is that when the vehicle is produced, it either comes together with the equipment, or the manufacturer may decide that for safety, let us transport the vehicle and then the equipment will follow. Here there was a disconnect. And there was a delay between the arrival of the...
But you've paid for those equipment, it just didn't come.
Oh yes, they are part of it.
So is the manufacturer bringing them?
Oh, they are bringing them. They are bringing them. Because
but in the meantime, let me tell you why. This one again from Kwame. Kwame says, thanks for reading my message. And I'm waiting for them. He's the same guy who wants to help, the volunteer. He says, but I was arrested by the police and he questioned if my car was an ambulance by carrying a pregnant woman to the hospital. So if these shockers thing hasn't come, can't we just continue to use them? And if the shockers come, we just plug them in there? Because like Kwame is saying, Kwame has nothing, but he was taking the pregnant woman to the... At least this has got something. Maybe it's not all there.
Actually, once the equipment is not on board, then it's just like an ordinary van. And so there will not be any difference between what we have.
No oxygen, there's nothing in there, no oxygen in it?
The oxygen delivery devices are there.
Well,
that's the only one.
It's better than nothing.
Are you getting the point?
Oh, yeah.
Yes. So, but you realize that there's always a contractual agreement at the point where the vehicles are brought in, they are cleared, they are inspected, and then there is training and then commissioning.
Well, all too soon, that's what time will allow us. But it's been interesting from the feedback. Everybody's, you got quite a few positive comments saying that you're on point and they like you. So I'll pass your message, I'll pass the message on. And well, that's the state of our emergency. We should get to the point where there are a lot of volunteers and a lot of us are putting money, maybe even into a fund that once the government resources finish, the emergency service can dip into this fund to save you and I, because you know what, it could be any of us at any given time. So thank you very much. But again, I'm reminding you that 26th of March, all roads lead to Edimasa. Your Majesty, Odenho Kwafokuto III himself, will come and grace the occasion for us. Doctor, thank you very much. We expect you in Edimasa.
No problem. Thank you very much.
Thank you for watching. Tomorrow we'll be back to do this all over again.